Spring Hills Post-Acute Care excels in the implementation of clinical best practices that focus on managing the harmful effects of patients with chronic health conditions. Our highly skilled and trained professionals work together as an interdisciplinary team that is trained to assess all clinical and non-clinical factors.
Our goal in the post-acute care setting is to be the hospital of the future.
We're here definitely to try to strive to make them feel comfortable and welcome when they come here in our center. We definitely want to deliver a standard of care that is appreciated by the family and will have positive outcomes for the patient as they enter here in our facility and as they leave if they're here with us for a short-term recovery.
Each member of the team has something so valuable to contribute to make what we do every day work.
My mom is assigned to a team which is absolutely the most compassionate team that we've come across. They are not only compassionate, they're responsive, and because my mother does not understand English, there's that language barrier, and they are very patient with her.
What I liked about it was the airiness of it, the lightness of it, the cleanliness of it, the fact, and this is most important, that the staff was smiling. And in my opinion, that is something that trickles down from the very top.
Through evidence-based and innovative physical, occupational, and speech therapy programs, we aim to bring patients back to their optimal level of function no matter what their diagnosis is, while keeping them safe and comfortable at all times.
The occupational, physical, and speech therapists, they all work together for the patient, and the flow is nice. The therapists who treat at the post-acute are also the same therapists that are treating at the assisted living. They already know where the patients are with regard to their socialization skills and also with regard to where they are physically.
The main purpose of post-acute care is to transition a patient from the hospital to home. So it's pretty much the bridge between the hospital and home.
Therapy here is phenomenal, so I think from top to bottom, it's about the patient and making them feel comfortable.
Any patient could get better if you guide them the right way and you provide the right activities, the right exercises.
This place changed my life, saved my life. I was really messed up. I was ran over by an 18-wheeler in New York City. He fractured both bones in my femur, my left leg, and tore my artery completely in half, and then shattered my whole tibia in my right leg. And then coming here, it's a complete turnaround. The therapy here is absolutely amazing because they said that my injuries, I wasn't going to be able to walk for 3 to 6 months, and I'm already on crutches. Just everything here has been absolutely phenomenal. Every day I wake up and I enjoy my days here.
Spring Hills offers a comprehensive and holistic care continuum that helps the patient along their journey from admission to discharge in our post-acute care environment for their long-term needs. Our unique approach to effective post-acute care transitions ensures that our patients receive the care they need, when they need it, and where they need it.
The benefit to having post-acute as part of our Spring Hills family is that all of the services would be provided through Spring Hills with our standards of excellence by providing a continuous care, making sure that all various different services that intertwine with that resident. Once they leave post-acute, they would go to one of our family buildings.
Being part of a growing company is great. Spring Hills has really turned us into a culture-based entity. It has gone through our residents and the residents' family members, and it's really made a big difference in just the overall attitude that you feel when you come into one of our communities.
The benefit of being a part of Spring Hills is that we can provide the excellent quality care that we normally do throughout all of our communities to the residents who deserve it.
It really had to have a comfort zone to it. And this place that I'm at, it kind of like hit all the bases. I needed something like that all under one roof. I didn't want to be traveling across town or even across the parking lot. I just didn't want that. And that was one of the biggest perks that this had for me. Plus it felt like home.
The benefit of a patient having a continuum of care is that the patient will receive the right care at the right time as they move through the healthcare space.
We take caring for people's loved ones very seriously and place a high value on the trust that we are given. Knowing that each stage of our patients' recovery can be emotionally challenging for them as well as their families, our team will ensure that all of our patients receive the personalized care they deserve.
Everything we do affects our residents. We just want to strive to make sure that they're comfortable in our setting. This is their home. Allowing them to trust us with their loved ones is really what it comes down to.
We have an interdisciplinary team approaching the families and the patients. So everything the patient's dealing with in the family, we are addressing to make sure any aspect of that patient's care is all addressed at that conversation.
They always invite the family in. When you come in here, you can see that people are overly helpful. They know all of our names and there's 5 kids. They make you feel comfortable leaving your loved one here. We love it.
We are honored to provide you and your loved ones with a true sense of caring, with a commitment to quality in everything that we do. We look forward to making you a part of the Spring Hills success story.